office has found that hospitals across the state are overcharging for cancer drugs. Now the treasurer is calling for lawmakers to increase transparency and put it to a halt. WECT's Ashley Balsavius looked into this today and has more details. Ashley, how much are they overcharging?
Fran, certain hospitals across our state are marking up oncology drugs at an average of 5.4 times their original cost. Now, the good news is no hospitals in our area are overcharging, but it's creating a ripple effect on the state's healthcare system.
Just talking about federal taxes.
New efforts are underway to keep North Carolina hospitals from putting profits over patients. It comes as researchers found that 340B hospitals that can buy outpatient drugs at discounted prices are overcharging state employees for cancer drugs. Dozier Memorial in Southport is a 340B hospital, but researchers say there isn't enough data to verify if they're overcharging. In a press conference on Wednesday, State Treasurer Dale Folwell said it's a serious issue facing the state's health plan.
When it comes to healthcare costs and rising prescription drug costs, this is like an onion. The more we peel, the more we cry.
The 340B program was originally intended to serve low-income rural communities. New data, however, shows they're expanding into wealthier neighborhoods, and they profited thousands of dollars per claim on drugs paid for by the North Carolina State Health Plan for teachers and state employees, with some hospitals charging almost 13 times the original cost. Frank Lester with the Treasurer's Office says North Carolina is the most expensive state in the country for healthcare costs, and that needs to change.
This is not about the hardworking people, the people that save lives every day. This is about the administration. These are about the people who have forgotten. They have started to put or have been putting profits over patients.
Julie Havlack is one of the researchers and says one of the reasons they're calling for greater transparency is because of the burden this puts on patients. She says 1 in 5 families in North Carolina is in collections for medical debt, and they can't afford to pay for overcharged medication.
And if patients are paying the full freight and being sued for the full freight of those drugs, despite the fact that hospitals are buying them at steep discounts, that's deeply concerning.
Now, Folwell is calling for reform for the 340B program, as well as hospital price reliefs for cancer patients, taxpayers, and state employees. Ashley Balsavius, WECT News.
Happening tonight.